Every week, we're taking your COVID-19 related questions directly to Toronto's Associate Medical Officer of Health in a live Q&A session. This week, we had parents concerned with sending their kids back to school and the possibility of children becoming super spreaders of the virus, much like influenza.
The evidence for kids, I think, is inconclusive by my estimation. COVID may not be like influenza where they can be super spreaders, but maybe they can, and we just don't have the full evidence on that. There's no question, though, that kids can still get sick. The older you are as a child, the more sick you could potentially get. We know adults get more sick than, say, younger children. And so what this means is that when we open schools up, we need to be able to open them up in a way that we can prevent the spread of COVID. And I think that that's the bottom line here. And so we've talked to our school boards in Toronto. They're developing their proposals. And it's talking about using public health measures to have schools open and places where children can learn and socialize, but while reducing the spread of the virus. So it means, for example, being in cohorts, perhaps smaller cohorts of students, so your risk of spreading it across the school will be different. Another big thing is screening, and so making sure that if you actually developed a cold, you got back to school, you developed a cold, well, that morning you would probably not send your kid to school, but if they showed up at the door and they said, yes, I have a runny nose today, they actually would not be admitted to school and they would have to go home. So then the question is, well, your kid now has a cold, how long do they need to stay home? So what we would recommend is actually that they get tested. We need to test our children to really understand what COVID, how many kids are actually really being infected. The testing proportions are so much smaller in children than they are in adults. And so I think getting a child tested who is symptomatic, if it's negative and the symptoms go away, then 24 hours after their symptoms get better, with a negative test, they could go back to school. So these are some of the things that we're trying to work through to be prepared for school to be able to provide guidance to school boards. They've actually taken our guidance. They've come up with really great proposals to mitigate the spread in schools.
In this week's session, we also had questions about the best mask to wear and quarantine protocols after travel. And for those answers and more, you can find the full Q&A on our websites citynews.ca and 680news.com. Point your phone camera to the code on the screen you see right now, and a link will pop up to take you directly to that article. For City News, I'm Dilshad Burman.